Well, hello, everyone. Welcome to our webinar. We will be reviewing temperature during the perioperative period, and this will be led by Dr. Joseph M. Hendrix. I am Dr. Catherine Tobin, and I'm an associate professor at MUSC, the Medical University of South Carolina in Charleston, and I'm also the chair of the Education Committee for SAMBA. I'll be moderating this webinar. For those of you who are not SAMBA members, please consider joining the society, as it offers many benefits to the members, including a discount at SAMBA's upcoming annual meeting this May. Also, you can visit our website to see the benefits of membership at www.sambahq.org. A few quick housekeeping notes for today. Please note the webinar is listen only, and in the upper right of your computer screen on the control panel, you'll see a chat box, and feel free to put your questions in that chat box. There's also a question box where you can enter these, and I'll be reviewing these, and I can ask Max these questions at the end. You can type a question or comment and submit it any time during the presentation. And as I mentioned, at the end, we'll have a Q&A at the end of the presentation. All right, so now to introduce Dr. Hendrix. So Dr. Hendrix is an assistant professor with the Department of Anesthesiology and Pain Management at the University of Texas, Southwestern in Dallas. He has been on staff since 2012, and his practice is primarily focused on ambulatory anesthesia, especially in complicated patients who aren't suited to the University Outpatient Surgical Center. All right, Dr. Hendrix, let's get it started.
Okay, thank you very much. I'd like to thank SAMBA for the opportunity to give this presentation today. Very much appreciate it. So we're going to be talking about, obviously, temperature during the perioperative period. It's a topic that I find to be quite interesting, and I find very interesting how confrontational it can sometimes be in a perioperative, peri-procedure setting. And the perception, I think, is more that perhaps this is the way it's always been, perhaps in operating rooms. They're supposed to be really cold, and so therefore they should always be really cold. It's quite interesting, the I don't know, conflict or resistance, I should say, to the idea that temperature is very important for patients during anesthesia. So for this sort of a presentation, it's going to be starting, of course, with our objectives. Going to go over a little bit of background, as dry as that might be, because it's quite important to know some of those factors that are important to understand when you're trying to prevent the development of hypothermia, as well as to reverse the hypothermia. The physiology of thermoregulation, hypothermia during the perioperative period, managing normothermia during the perioperative period, and coming to some conclusions. So we're just trying to get to the point of sort of helping to understand the physiology of thermoregulation, the effects of anesthesia on thermoregulation, the importance of perioperative normothermia, measures and guidelines for perioperative temperature management. So, as is pretty straightforward, surgery in general is going to be pretty stressful on the body. And so this is going to bring about all sorts of major physiological changes that tend to come about during surgery. There are lots of physiological parameters that are going to get affected by anesthesia, but one of those is going to be temperature. And hypothermia during the perioperative period is a common complication leading to some fairly important adverse effects. In fact, the data would tend to suggest that post-anesthesia, PACU, recovery room, however you wish to define it, despite being within SCIP guidelines, within CMS requirements, within being emphasized seemingly on a pretty significant level at a regulatory level, you still find that at least per most studies and most evaluations that almost 50% of patients are coming into the PACU, coming into recovery in a hypothermic state, despite the regulatory discussions of these issues. So I guess some pretty basic, straightforward definitions to try to keep us all on the same sort of a level. So if we're talking about the normothermic state, basically what we're trying to get at is to a level of core body temperature where the cells are neither having reduced activity or increased activity just due to the thermal stress. That's really the key component that you're looking at here. So when you talk about a body core temperature less than 36, the important point about that is that that is the level in a non-anesthetized person at which the body tends to want to respond to do something to try to get the temperature up. By the same token, the body core temperature, once it gets above 37.5 degrees Celsius, that's when the body tends to respond to try to get the body core temperature